It revolutionized cancer treatment and is considered to be the most promising tool to efficiently treat rare diseases. While research is still looking into its full potential, precision medicine is the star of our panel today. Welcome everyone, wherever you are. My name is Rawa Oje and I will be your host for this panel, part of Wish 2020. My job is to talk to people, especially women, and listen to their stories. And one particular story comes to my mind today. The story of a young woman who was trying at the age of 30 to have a baby. When she gave up on the natural process and went for medical intervention, she spent 2 years of her life getting pregnant naturally and artificially, but all ending up in miscarriages at different stages of pregnancy. Then, after 6 miscarriages, her doctor decided to conduct genome sequencing and found a DNA mutation that causes miscarriages if you are taking folic acid, the very commonly used supplement by women. She got pregnant and gave birth to a healthy child just by stopping folic acid. This is a happy ending, but to a very sad story, because it makes us wonder about all these patients who do not have access to genome sequencing, whereas their treatment might be very simple. And in this case, the life of the patient was not threatened, but what about lives that could be saved? Precision medicine is no longer futuristic. It is here. So what is obstructing its full use? I will let the experts answer these questions and tell us more about the latest advances in precision medicine. I have with me a great panel. I will introduce members in alphabetic order. We have with us Dr. Lutfi Shukan, Professor of Genetic Medicine, Microbiology, and Immunology at Weill Cornell Medicine in Qatar. We have with us also from the USA, Dr. Victor Zhou, the President of the National Academy of Medicine in the USA. We have also David Humphreys, the Global Head of Health Policy at the Economist Intelligence Unit. And we have with us in the studio Dr. Saeed Ismail, the Director of Qatar Genome Program. We also have with us Dr. Walid Qurunfli, the Director of Healthcare Research and Policy at Wish. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. Each member will answer my first round of questions in 3 minutes. Then we will move to your Q&As. So make sure you send us your question as soon as they come to your mind so we can have them ready in time. And we will wrap up in the end with the concrete recommendations and actions to be taken to move forward. So let's start with the WISH report this year about precision medicine. My question goes first to you, Dr. Walid Qurunfli, the Director of Healthcare Research and Policy at WISH. Can you give us a brief overview of the report and outline its key messages?
Yes, thank you, Rawa. I'll be glad to do so. So let me do just 2 things. First, I'm going to take 30 seconds to bring context to this report, and then I will detail the report. So WISH has produced a forum report back in 2016 that was led by Dr. Victor Zhou that put a framework for how precision medicine should be sustainable. And from there, we know in the next 4 or 5 years, there has been a tremendous progress in the healthcare system, as well as in precision medicine technologies and tools. This promised that there will be a transformation in the healthcare. And this has been and there are many bright spots. You mentioned a couple of them, cancer and rare diseases. And this has been enabled largely by big data, as well as other analytical tools like AI and machine learning. The big data sort of has been seen a growth and an expansion in terms of volume, with issues around storage and security, in terms of variety, the types of data, in terms of velocity, which is the need to be in a real time so that we can assess the situation of the patient or the situation. And certainly precision medicines have contributed tremendously to the COVID situation. In that regard, when we looked at the policy brief that we have drafted, we wanted to make sure that this is a precision medicine that addresses strategies as well as processes. And one aspect of that is really to harmonize the activities among the different players. And one aspect of that, of course, is the integration into primary healthcare. So what we sought is to provide really pragmatic and practical key recommendations that are not only applicable to Qatar, but also applicable internationally. So the overview really illustrates the role of precision medicine in healthcare and what are the challenges. It talks a little bit about some of the Qatar initiatives, like the Qatar Biobank, the Qatar Genome Project, and the vision to create the Qatar Precision Medicine Institute. And then it talks about where this field is headed in terms of the future. It talks about the requirements to establish precision medicine. An example of that would be the infrastructure. It talks about the barriers. What are the barriers really to implementation? We've been focused largely on implementation. And it talks about really the principles of integration, because without integration into the primary healthcare system, then precision medicine is largely theoretical. It highlights some of the programs that the primary healthcare system here in Qatar has initiated, which is a population-based cancer screening that have screened for breast cancer 50% of the population. This is tremendous. And this dovetails with the other policy brief that will be presented tomorrow on cancer. And it talks specifically about building capacity, because it's important within the healthcare system that there's a capacity, and within Qatar, of course. So some of the key recommendations that are applicable, as I said, within Qatar and outside Qatar, is how to communicate value, especially if you have a system that relies on insurance and payers. That would be key. What type of sort of information management system? You can have the structure, but the information management system is extremely important because you are dealing with a tremendous amount of data. And then it talks about, as I mentioned, one of the key points, which is the integration to primary health care system. Equally important, we haven't forgot about patient centricity, because we talk about patient engagement and empowerment. Without patient engagement and empowerment as an equal in the conversation of precision medicine, then I think we will face a bit of a challenge in terms of the implementation and the realization of the dream or the vision of precision medicine. Last but not least, it's important to communicate to the community and make them aware of precision medicine and its potential. And I think our ability to communicate in a layman terms to the public is very important. And I always say that culture and tradition play an important role. What you see in the Middle East, you might not see in Western Europe or North America. And as a result, you need to adapt your message and adapt your type or method of engagement. And equally important, I think there is a tremendous stress in the healthcare system. And so a specialized type educational program for professionals would be key. So briefly, this was the intent of this policy brief, and these were the key recommendations. And I get back to you, Rawa, so that you can carry on with the rest of the panelists. Thank you.
Thank you, Dr. Walid. We'll definitely get back to you with many questions regarding your short briefing. Now to David Humphreys, Global Head of Health Policy at the Economist Intelligence Unit. Today, the Economist Innovation Unit has also launched a report on precision medicine, to which many of your fellow panel members contributed. Might you be able to share some of the key insights from this report, please?
Well, thank you for the introduction and certainly the opportunity to participate in this wonderful forum, and certainly to the Qatar Foundation for their support in allowing us to to do one of the most comprehensive reviews of precision medicine. And our focus with the study was really looking at that long talked about promise of better, more targeted care for patients and ongoing basis barriers it face. As we get into the work and I talk about some of the key highlights around those challenges and opportunities for application, it's important that we have a clear sense around definition. Precision medicine is like many top-level phrases in healthcare that can be blurred with other terms that have narrow or broad definitions that may lead to confusion and misinterpretation. But at its heart, it offers the opportunity to move from a trial and error approach to more tailored interventions. And with that in mind and that principle, our work really looked at underpinning 4 interwoven data-related enablers, increasing use of volume of data, growth in types of data that are relevant to health systems, a greater capacity to store data, and certainly the gains in analytical technology that facilitate better and more actionable insights. Now, as part of that process, there certainly are ongoing barriers that disable or certainly hold back the development of precision medicine. Some of those are quite typical. The usability of the data, weaknesses, underlying infrastructure from laboratories to each EHR platforms, the stakeholder expertise and their buy-in, and being able to change the way we operate within health systems. Our study really focused on 2 critical aspects that we consider to be important to overcome. The first is really around the precision medicine integration into this patient centricity movement. Certainly the broader patient-centered trends of activated patients and shared decision-making are good steps. But when inserting precision medicine into this discussion, it's clear that further education is required, starting with the fact that patient-centric care and precision medicine aren't necessarily the same. They can reinforce each other. Patient centricity provides holistic insights that are valuable. Precision medicine offers a mechanism to make those actionable. The questions do remain if the current system facilitates that interaction. Questions also exist about ethical behavior and trust models that balance privacy, needs of individuals, and greater population health and societal good are certainly a work in progress. The second piece that our study focuses on is the concept of return on investment and value demonstration. Much has been said about precision medicine generating savings, and there's certainly great examples of what that looks like. But there are also evidence, one particular study that we looked at in a global review of precision medicine intervention demonstrated that nearly 30% of those initiatives were either inconclusive or found the intervention not to be cost effective. It's also a clear lack of definition around what does ROI mean, different measures, time frame, impact, a holistic view. And so having more clarity around that ROI and impact in health system is really very critical. The flip side from those challenges is there are numerous examples on even comparing studies that we have done in the past in cancer care and rare diseases demonstrate that there are more examples of real impact from Japan's initiative on rare disease and undiagnosed diseases, connecting patients with genetic conditions to clinical centers and multidisciplinary diagnostic committees, better treatment alignment, like the case of NHS in England, using whole genome sequencing to test bacteria in new cases of tuberculosis, to preventative issues, even to patient integration to drug development. All these are positive examples and roadmaps of how we can apply precision medicine within the health systems that we have today. One particular aspect that we centered on was the role and integration of precision medicine into public health, and looking at as the application of the tools and technology approaches that precision medicine offer to long-standing tasks and goals that public health has. And you see a variety of applications and research that explore elements as genomics could be applied to public health tasks like screening and infectious disease surveillance in the case of HIV or Zika. But it's still unclear around those definitions and some confusion around how precision medicine really incorporates into public health as expressed by our experts. But again, maybe this is a bit of a terminology as part of the issue. As one of our experts stated, today's work is just public health with better data. I'll conclude with kind of the conclusions that we reached within the study, and many of the same things that have been talked about for some time, resolving key practical challenges, access to usable data, getting stakeholder alignment, seeing where you integrate into public health, or as Dr. Warlig mentioned, into primary care, focusing on what problems to solve with precision medicine, where to invest. The likely will evolve over time as underlying infrastructure and expertise, culture, and value models evolve. The last piece that I will leave you is the definition of value itself. And I think that the broader context of the pandemic is more relevant than ever, that health has an impact, not just on health outcomes and population health, but on societal value. And those new models being developed that incorporate the impact initiatives on health, but other aspects that drive success, productivity, and social needs and quality of life. And taking that holistic view and having new definitions and a time frame for precision medicine, I think is really very critical for its uptake. With that, I look forward to hearing any questions about the study. You can find it on our site, eiu.com, and I will pass it back over to you, Ron. Thank you so much.
We'll see what the audience sent, but I definitely myself have a lot of questions that I will keep for the Q&A. Dr. Victor Zo, President of the National Academy of Medicine, yourself, you chaired the 2016 WISH Forum on Precision Medicine. How has the field changed since then? Dr. Zo, I'm sorry, could you unmute your mic?
Thank you very much. You know, I followed instructions so well.
Now we can hear you better.
I turned my mic off. Yes, thank you very much. I followed instructions so well, I turned it off, but forgot to turn it on. So I'm very pleased to be participating again in WISH, which has always highlighted precision medicine from the very beginning. As you said, in 2016, WISH had a major policy session, which I chaired, where we released our report on precision medicine. And I'm so glad to hear Dr. Walid's report this time. I want to take a minute to tell the audience of the leadership of Kata in precision medicine, because even back in 2013, Her Highness Sheikh Kamoza announced the launch of Kata Genome. And I was privileged to be involved at the very beginning of her vision when she asked me to develop a plan for Genome Kata. Our report, called A Roadmap for Personalized and Precision Health, led to establishment of Kata Genome Project, which you'll hear, I'm sure, from Dr. Saeed later. It did bring together all the key leaders, stakeholders, if you will, from the Kata Biobank to, in fact, the Kata Biomedical Research, Computing Research, Harvard Medical Center, University, and Weill Cornell to work together. So the first 5 years have been extremely productive, thanks to the leadership of Dr. Saeed Ismail and, of course, Dr. Asma, in building the infrastructure, the foundation of PM with genome sequencing, Q-chip, bioinformatics, ethics policy, patient engagement, and you'll hear a lot more about this. A little bit over 2 years ago, Her Highness asked me to lead a 5-year review of the Kata Genome program. And the Scientific Advisory Council, which I chair, recommended the creation of a Kata Precision Medicine Institute in order to, as you heard from the other speakers, integrate and bring these pieces together to move into the clinical arena. So Qpmi, in fact, was launched exactly 2 years ago by Her Highness at the opening of Sidra Hospital just before WISH 2018. And currently, I'm leading the development of a strategic plan for the next 5 years, particularly in trying to move all these great advances to patient care. And this will be presented to Her Highness on November 22nd to the board as well. So you can see a lot has happened to 2016. First of all, genome sequencing technologies has improved and costs have dropped dramatically. Now you can sequence the entire genome for $400 or less. Importantly, as you heard from the previous speakers, the field has been expanded far beyond genomic and sequencing to incorporate new technologies, the omics, but clinical information, electronic health record, and data from many sources, wearables, lifestyle, social, environmental data. All this requires data, computation, information, and analytic capabilities. The idea at the end of the day is to tailor individual diagnosis and treatment, and it will be implemented in healthcare systems, in primary care, as well as you heard at the population level to advance this concept of precision public health. So, since 2016, we've seen many large-scale national initiatives. The US have the Precision Medicine Initiative called All of Us. China has launched a Precision Medicine Initiative to sequence 10 million individuals, Singapore, and many others, too many for me to cite. So everybody is now realizing this is the future of health, if not the present. Also, as you heard from yourself and the other speakers, precision medicine being practiced clinically. In 2016, we talk about newborn rare disease cancer genomics. And certainly in cancer genomics, we've seen a lot of advances in targeted cancer therapy. Everybody knows about the non-small cell cancer carrying the activating EGF receptor mutation, which now you can get targeted effective therapy. Pharmacogenomics, another area we've seen great progress. You talked about that in the folic acid example. Certainly for the practitioners, we think about the use of warfarin in patients with gene variants of CYP2C9. You have to adjust the doses to reduce the risk of prolonged prothrombin time, the risk of bleeding. Patients with mutation of TPMT, if you receive azathioprine, a immunosuppressive medication, you have high risk of developing severe neutropenia. So we are clearly moving these things into practice, but not systematically. We need a lot more. And as you heard from my previous two speakers, primary care and public health. So more and more people are trying to move into primary care, but not quite there yet. As far as public health, there is in fact now in many countries in US, newborn screening routine, the largest established precision medicine public health program. Fragile X syndrome, severe combined immune deficiency. And also at the population level, looking at common genetic conditions that are associated with preventable premature death from cancer, heart disease. For example, breast and ovarian cancer syndrome, familial hypercholesterolemia, you can screen for BRCA gene mutation, LDL receptor. So it is the foundation, the beginning of moving these genomic concepts into the population, just like cholesterol 60 years ago, first by Framingham study, which is now used routinely for screening and prevention of cardiovascular disease. Another big advance you hear from Dr. Saeed will be the microarray gene chip technology, because now you can use the large-scale genome information from sequencing, but reduce quickly into practice into these microarray chips that can be, in fact, carry hundreds of thousands of gene variants and disease-associated mutations to be used clinically in research and diagnosis. So that's very exciting. And of course, as we're looking forward, the emerging area of use of AI, machine learning, can be applied, as you heard from Dr. Valid. But as you heard from David Humphreys, there are really many outstanding issues. Number one is integration to practice. This remains a barrier because people have to learn a new skill. They also have to do the testing. They have to interpret. It also takes time. So we still have a fundamental challenge in interpretation and clinical practice. As David Humphreys said, we still need a lot more data. The outcomes are not as clear. You need a lot more, and of course, the economics, the cost regulation, economic impact, patient engagement, empowerment, education, workforce. So I'm going to finish by saying the Qpmi strategic plan, which I'm leading, will address many of these elements to move precision medicine to clinical care and public health to improve the health of Kata. The plan is to move from pilots to scale, from specialty to primary care, and from healthcare to public health. And I want to thank Her Excellency Hanan Al-Kuyari, Minister of Public Health, for her support in moving the clinical piece to move along with the genome piece and the precision medicine piece. So I think in 2020, the world is better prepared, aligned for precision medicine, but we still have ways to go. Thank you.
You gave us a great introduction to Dr. Smaid. Unfortunately, he's not next. Next, we have Dr. Lotfi Shoukan, the professor of genetic medicine, microbiology, and immunology at the Weill Cornell Medicine, Qatar. Dr. Shoukan, why do you think the implementation of a precision medicine program is likely to succeed in Qatar? Where do you see the most impact?
Thank you for the introduction. Just to correct my name is Lotfi Shoukan, not Shoukan. Okay.
Sorry.
I see at least 5 factors which could make the implementation of precision medicine program is likely to succeed in Qatar. As mentioned by the previous speakers, the leadership of the country is committed to provide resources and accessible healthcare services to the entire population, but also to deliver precision medicine managed according to the world-class standards. This is the first factor. The second is the world-class healthcare and biomedical research facilities are already available in Qatar. The third one, and Qatar has successfully dedicated through a number of different initiatives and projects to attract world-class physicians and researchers who are investing heavily in local capacity building. In this regard, we do have 2 main programs, academic program, PhD program launched by the Hamad Ibn Khalifa University entitled Genomic and Precision Medicine, which is in terms of capacity building, it will provide the manpower for precision medicine in Qatar. The other program is the genetic counseling, master in genetic counseling in Qatar University. The fourth factors supporting that the implementation of precision medicine is likely to succeed in Qatar is that there is a relative ease in implementing a precision medicine program in a population with the size of the Qatari population. Last but not least, I think with the launch of the Qpmi, or the integration of Qatar Genome Program and the Qatar Biobank, the new avenues could be opened by for the biotech and pharmaceutical industries. The effective application of precision medicine in Qatar could improve not only population health, but also the development of knowledge-based economy. Seeing Qatar as a potential hub to GCC and other markets, biotechs and pharmaceutical companies from the US and Europe could be attracted to set up a joint business venture in Qatar. So in terms of impact, I think as mentioned by other speakers, precision oncology, which is cancer, is really a very attractive field for precision medicine, which could have an impact not only in Qatar but worldwide. But I see specifically for Qatar could be as a potential precision medicine hub for rare diseases, and this is for many reasons. As we know, rare genetic disorders represent a significant source of morbidity and mortality in population with high rates of consanguinity, including in Arab populations. And they are estimated to be the second leading cause of mortality, of infant mortality in Qatar. So many of the genetic diseases that plague Arab population are not greatly shared with other populations, which means that genetic testing developed for other populations are of very limited value for the Arab communities. For this reason, I strongly believe that Qatar could play a major role, not only implementing precision medicine in Qatar, but also to be a hub for rare diseases in the Arab world. And I'm going to stop here, and I would be happy to answer any question you might have.
We will get back to you for sure. Thank you, Dr. Shoshan. And now to Dr. Saeed Ismail. Apparently, you're the star, according to your colleagues here. You've been heading the Qatar Genome Project for the past years. What have you learned so far, and what was going to happen in the coming 2 to 3 years?
What we've learned during the past 5 years is that the decision that was taken 5 years ago, and I have no credit in that, by the QF leadership, when they decided to launch a national program to lead the national efforts to prepare Qatar to become a leader in precision medicine, was the right way to do it. Having scattered projects here and there in hospitals and research centers, universities was not going to put Qatar at the forefront of implementation of precision medicine. Having a small group of people under the title of a national project like Qatar Genome Project, and then try to sort of coordinate all the and spearhead all these national efforts. Again, the universities, the healthcare providers, Hamad, Sidra, even the Ministry of Public Health, the legislation bodies, and everybody around a common vision was the way forward. It's not an easy task to coordinate all these efforts, but this is the only way to do it. What we've also learned is that as it is the case with any sort of learning process, the beginnings are slow, the beginnings are difficult, and then your curve will start to shoot up. You will start to see things speed up, and then you will start to see things happening at a faster rate, and you will see the outcome of your investment. The past 5 years, we spent a lot of time and effort in producing data, in making it available to researchers to mine it, in working with the universities to establish the right programs that will generate local human capacity. We spent a lot of time working with the Ministry of Public Health on preparing some guidelines and policies. We've worked with all sorts of stakeholders to sort of pave the way, as we always say. This is the cliche we use. We pave the way towards precision medicine. Now we are at a stage where we think it is the right time, as Professor Zhao indicated, to sort of harness what we've done and achieved and produce over the past 5 years, and try to basically shift gears from research, producing data, getting the researchers to work on the data, and try to implement as these outcomes at the clinical side, and basically show the patients that this can impact their life or the healthcare they are receiving. And even that's not going to be as straightforward. And as Professor Zhao again indicated, you have to choose your models where you want to start to show the impact. Pharmacogenomics is one place. The Qchip, which we produce, is another example. Basically, this Qchip is a summary of variants that we've discovered or sort of studied in the Qatari population. And we think that they are related to a wide array of diseases. And so we've put all those hundreds of thousands of variants on a very small chip, which will be able to offer diagnosis to dozens of, or even more, of rare diseases and other diseases that were undiagnosed or require a lot of different single assays in parallel to basically reach a diagnosis, and will hopefully basically shorten what they call the diagnostic odyssey. Mm-hmm. Basically, experts know that a family with a child born with a rare disease might take 5 to 6 years to come up with a diagnosis. With the new solutions we and other large-scale genome projects are providing, this diagnostic odyssey could be cut into a much shorter time. And we are all aware of how important it is to reach an early diagnosis in order to become with an effective treatment. Mm-hmm. And it's not just on the diagnostic side, it's also on the preventive side. We are now more aware of the genetic mutations or variants that make the Qatari population or individuals in this population more prone or more at risk of this or that disease, and thus we can provide better advice to healthcare providers and the people who put strategies for healthcare in Qatar in the next decade or two about where to shift their sort of campaigns, awareness, what are the basically more important things to tackle and try basically to prevent disease, not only diagnose it in a better way or treat it in a better way. So I think we are now at a stage where we can actually harness, as I said, the hard work and the huge amount of data that has been produced in the past 5 years.
Thank you, Dr. Ismail, and thank you everyone for sending your questions. I hope we will have the time to get to go through all of them now with the Q&As. So I have a first question going to Dr. Zhou. In countries with higher populations like the US, what does it take to build the infrastructure for precision medicine?
Well,
don't forget to
thank you
unmute
for
your
asking
mic.
that question. I think it is unmuted, is it not?
It's working.
Yes.
Yeah, it's working.
Thank you.
It's working.
Thank you for asking the question. I think just like in Kata, every country has to build that infrastructure over time, starting, in fact, you heard from both the technology of the omics to the computation capability to collection of data and the integration of this and move into practice. One area I do want to emphasize is community engagement. So what we've learned very importantly is that getting people involved and empowered is really important. In US, all of us spent initially a lot of time making sure that we get the average individual involved, volunteer to be part of a study, and importantly, that it represents the diversity of the population. So I think in every country, all these technologies has to be built, brought up, but importantly, has to be, in fact, begin to pilot into practice. So let's not forget education, genetic counseling, all this work. So there's a fair amount of work ahead of all of us. But the good news is many, many countries are getting ready, if not already on the way towards precision medicine. Thank you.
Thank you, Dr. Zhao. Speaking of infrastructure, this will take me to a question addressed to Mr. Humphreys. I'm sorry for the people who asked the questions. You did not put your name. Mr. Humphreys, financially, the immediate cost of building infrastructure for precision medicine might look substantial to governments, but on the long term, researchers assure that its implementation would reduce cost on health systems. How do governments weigh this equation?
You bring up an interesting point in that time frame, the time dimension of being able to realize those investments and see the return of those investments is really very critical. And I'm struck by the examples mentioned here today, particularly in Qatar, that one of the keys to success is leadership and political will, to set up the infrastructure required in data and understanding and culture and integration and the like. And so that time frame for investment, and I think today in the situation that we're living in many countries of the world, emphasizes the here and now and the challenges that we face, but we have to work towards making long-term investments in people, in infrastructure that enable the science that we don't even know is possible, but is to come. And so the countries that are more successful in generating better outcomes, being more efficient, have actually had that political will and leadership to make the investments necessary. It's also could be a strategic advantage for countries in different regions in the world to make these investments, the building blocks for future health systems and for future innovative industries. And so that is the best answer that I can give. And staying out of the trap of being just focused on the here and now is really very critical in expanding the view of impact beyond just health, that a healthy population has an impact on productivity, has an impact on the educational team, it has an impact on a variety of things. And so that measure of value is really very critical in how that is framed.
Dr. Koronfle, what would you say to those who would argue that we haven't even gotten the basics right in terms of providing routine care, such as vaccinations? So why should we be investing our limited resources in precision medicine?
Thank you, and thank you for this question. I mean, it's always a struggle in terms of how you measure the return on the investment for the healthcare system. Part of it, we said, it's leadership and political will. But the other part of that is that you have to look at your population as a healthy population, you know, because there is a return on investment in that, as David has said, in terms of economic productivity. But at the end of the day, I think there are a series of educational and professional programs that need to be implemented. And one aspect of that, which I mentioned even for the Economist report, is really the need for a reform in medical education. And I think that's really key in order to prepare the next generation of physicians, because the next generation of physicians has to deal with different kind of technology and different ways of sort of diagnosis. I mean, a physician that needs to speak the language of AI, machine learning, omic tools, ability to look at the data, analyze it, digest it, and they even present it to the patient. So that's one aspect. But in the interim, I think there has to be a widespread reform in the healthcare system itself in terms of how you train your professionals. I think the healthcare system, and COVID has sort of showed that, is a bit stressed. And then you're asking physicians, nurses, physician assistants to perform this sort of an extra level of productivity and knowledge. And I think preparing a workforce is really key. So in Qatar, of course, Dr. Lutfi mentioned a variety of capacity building programs, but Qatar is not isolated from the global arena. And I think that's pretty much the case, whether it's in Western Europe or North America, and the importance of preparing the workforce and the importance of preparing professionals in the healthcare for this new wave, what we call future medicine. And I think Dr. Zhao wants to do a follow-up comment on perhaps what I said.
May I? Yes. Well, I do want to...
Yes, sure, go ahead.
Yes, I hear very much the question, perhaps in countries that have less resources, how do you build up the building blocks, and how much, resources will you need while we have already other needs? I just want to point out that, if an average patient that comes to see a physician or provider have to achieve a diagnosis and treatment, and the trial and error is a big problem. We have released a report at National Academy that 40 to 50% of diagnosis and treatment in the global sense, particularly in low-income countries, are in error. And so you can imagine the amount of resources needed, in fact, and not yielding good result. Precision medicine allows you to cut all those corners, if you will, and go straight to the right diagnosis and the right treatment. So that certainly is an argument for investing in this area. Perhaps for low-income countries, the best is start in steps. That is, begin to think about genetic history, doing the testing that are, in fact, more routine and obvious, and then move up to a larger investment when there's more information emerging from the research and the application for the, from other countries. I think that may be the way to go. Thank you.
I think there's a great example of that.
By building a data pool. Yes.
I was going to say there's a great example,
yes, Dr.
just as Dr. Zhao said, that if you look at Genome Africa, where the Sanger Institute, Wellcome Trust, where is the NIH in the US, and precisely is to help less developed countries, but there is a value in that in terms of the information, the knowledge, and the diversity actually of the genome and the data that will be available, that all can benefit from it. So yes, small steps can go a long way.
So from what I hear from everyone here in this panel is that you have to have in parallel steps, building data, preparing the right personnel, and investing financially, and also patient awareness also of, because a lot of people are not really opened up to share this much data. A lot of people are afraid for their privacy, and they're not really happy when they hear words like having a chip or microchip with all the fake news about it, and that people will control us and so on. So I guess there's a lot of ways to go to move forward. But as Dr. Korunfli said, the first is to prepare the physicians, which takes us to Dr. Shushan. Is the new curriculum really helping future physicians and healthcare providers be up to the task?
Yes, indeed. Actually, even on our medical program, curriculum is adjusting some principles related to precision medicine. For instance, when we talk about genetic medicine, now we are talking about genomic medicine because there is evolution from genetic to genomics. And as I said earlier, even for the context for Qatar, we are launching and setting a program dedicated specifically for precision medicine, such as the genomics and precision medicine at the HBKU. So yes, indeed. So in that determined at the level of the medical education, but other programs, we are taking in account when we set precision medicine as a goal. We have to adjust our curriculum according to the new avenues and the new formats of, such as precision medicine.
This takes us to Dr. Ismail. By 2025, the Qatar Genome Program is expected to have a genome mapping of the entire population of Qatar. How will this change, and do Qataris are open to sharing this much data and getting their genome sequenced?
Let me just go back quickly to a point before I answer your question, which is how we can help low-income countries. And let me just shed light on one of our latest projects. We've just very recently started sequencing the genomes for thousands of Arabs living we call them long-term residents in Qatar. Mm-hmm. And that will give all Arab countries, and even countries beyond the Arab world, in the greater Middle East, a chance to make use of the huge data we're producing here in Qatar for those individuals. And we are about we are contemplating basically, even eventually when we get this data, to make use of it and incorporate it in this chip. And this chip is not very scary, by the way. It will be used in diagnosis. Going back to your question, after 2025 and whether the Qatari population is welcoming this, 2 years ago, we've conducted a national survey. And we've asked basically healthcare professionals how important is it for them to go into precision medicine, but we've asked also the Qatari population, a representative sample of them. How much are you intrigued by your genetic makeup? Do you want to know about your risk of disease? Do you want, eventually, this last question, are you willing to donate a sample to a national Qatar Genome project? And the answer was very, very welcomed by Qatar Genome. Over 71% of those surveyed said not only that they are willing to want to know about the genetic makeup, they are willing to donate a sample for Qatar Genome project and for research purposes, not only to get something in return. And this is among the highest you can get in other countries like Estonia, genomics in England and other countries. So the Qatari population is supportive of this initiative. And in 2025, if you ask me what would we love to see, I will give you just this example. Someone goes to a clinic and then he's suffering from this or that heart disease, and the doctor is prescribing an anticoagulant, say warfarin. And we all know that warfarin, you need to adjust the dose up and down, so you don't want the blood to be too thin, or you don't want to give a dose that is not very effective. And patients do go in these trial and adjustment. Yeah. The ideal situation after many years is that you go there, the doctor prescribes warfarin, the genome of this guy could be in the electronic healthcare records. The system will tell the physician that you put this man on 3 milligrams per day or 5 or even higher. This is the one example that brings up the importance and the beauty of precision medicine.
I have a question that will go to everyone in the panel coming from the viewers. COVID-19 is understandably dominating much of the conversation around healthcare at the moment. Some early studies have identified certain high-risk genes as risk factors for poor COVID-19 outcomes. What role might precision medicine play in helping us to tackle the pandemic or other pandemics maybe in the future?
Absolutely. I mean, we're all seeing that some people get the virus asymptomatic, others need intensive care, and this is largely due to the genetic makeup of those infected. Qatar Genome Project has joined the international efforts. We're part of this largest consortium in the world studying host genomics related to disease severity, COVID-19's disease severity. And the whole world is coming together because you need a lot of samples, a lot of patients. And we are the only representative in that consortium from the Middle East. And we are now with our international partners studying what genes actually are affecting the severity. And again, the outcome of that, if I want to be optimistic and tell you what could be the case, who knows? You could, if you discover those genetic determinants, you could stratify patients and you could know and tell who are at higher risk, so you keep an eye on them. And that's the beauty of again, of precision medicine, that you can predict disease rather than just deal with it after it's the onset.
Maybe we'll find a gene that causes some people to be more reckless than others also in dealing with the pandemic. Dr. Zhou, I address you the same question about COVID-19, but also about how can we deal psychologically with patients who have other concerns than their health. They have concerns about their privacy. They have concerns about they don't really like this technology. They like traditional medicine.
Yeah. On the COVID, I think Dr. Saeed is absolutely correct. Kata is playing a major role. And I'm aware of course, as you heard, the international consortium that comes together, bringing large amount of data, look at what they call host genomics and viral genomics. On the virus side, you can see how it's mutating and whether it's changing its characteristic, whether it's more transmittable. And on the host side, you can see who are more susceptible. So this is going to be really important, not only creating a public health strategy, but possibly even therapeutics. With regards to the concern of individuals, I think it's absolutely important that we have patient engagement and empowerment, as the report says. That is, the patients have to be well educated, feel comfortable, have trust in the government on the use of their data. I also think that it could be optional. In other words, at the beginning, you certainly cannot enforce everybody to say every single my information, therefore is controlled by somebody else. But that being said, I think in the long run, when people get a lot more trustworthy and also confident, this could be very effective. So the engagement of patient population, the community, the education is critically important.
Thank you, Dr. Zhou. And last but not least, Dr. Koronfle, we've accomplished so far. Where do we go next? Where should be our area of focus?
I think for precision medicine, I think the future is bright. And I always remember what Lee Hood said. It's one of the early papers where he sort of put the vision for precision medicine when he said, there will be a time where precision medicine is going to be precise, predictive, preventative, and participatory, and he referred to that as the P4 or the 4 Ps. So the future, particularly in Qatar, is extremely bright, as Dr. Zhou and Dr. Saeed has explained, especially with the creation of an umbrella or an entity like Qpmi, the participation in different genomic projects and the participation on the international stage, like with the COVID. And I think there is a really strong leadership and a political will that is driving implementation into the primary healthcare system here in Qatar. And similarly, you can see it in small countries. I mean, countries like Iceland, Estonia, the Faroe Island, those sort of types of projects that have demonstrated and have been successful in terms of showing the return on the investment in terms of precision medicine, and also what I call the next public health, which is precision public health. And you're gonna see a tremendous evolution in the area of computational power in terms of AI machine learning. And I think that information age for medicine is here, is very here, and it's real. It's not theoretical anymore.
Yes,
Thank you.
it is absolutely here. Dr. Ismail, we have the time for one last question. So with the Qpmi now being the bigger umbrella for Qatar Genome Project and many other projects in precision medicine, what do we expect in the coming years?
We expect translation, as I said, of the research outcomes in the past 5 years into impactful measures at the healthcare providing sort of level. We expect to be more closer to Hamad Medical Corporation, Sidra Medicine, those who do deliver this service to the patients. And we also expect that we could have more awareness campaigns. As I said, a lot of precision medicine is about prevention, and patient empowerment that Waleed mentioned is a very nice way to describe this. People, patients, or they're not patients yet, they have to become more aware of what their genes are making them susceptible to, and what are the measures that they should take to listen or live with this risk and deal with it.
Thank you. We're looking very much to it. Thank you, everyone, for joining us online. And thank you to my distinguished guest, Dr. Lutfi Shushan, Professor of Genetic Medicine, Microbiology, and Immunology at Weill Cornell Medicine in Qatar, Dr. Victor Zhao, President of the National Academy of Medicine in the USA, and David Humphreys from who is the Global Head of Health Policy at the Economist Intelligence Unit, and Dr. Saeed Ismail with me, Director of Qatar Genome Program, Dr. Waleed Qurunfli, Director of Healthcare Research and Policy, who will be with us tomorrow as well for the panel about cancer care. So don't forget to tune in tomorrow at the same time for our next panel. Stay safe and healthy, and see you soon.